Good afternoon, everyone. Reducing inflammation with food is the topic we are going to discuss with Dr. Whitney. Dr. Whitney's journey of self healing started when she finished her undergraduate degree and her passion to become a naturopathic doctor. She has been trained in UNDA number therapy, a gentle homeopathic intracellular drainage program. And also with Carroll Institute to become the only personally trained naturopathic doctor in Wisconsin to perform the Carroll Method of food intolerance. These two unique approaches, when combined, create an incredibly effective means to address the underlying cause of ill health once and for all. I am Amita from Nourish Talk, a global platform for natural and holistic therapies. I'd like to introduce all of you to Dr. Whitney Cronin, who's joining us live from Wisconsin. Welcome, Dr. Whitney.
Hi, thank you. Thank you for having me.
Okay, so let's just get started with the overview of what we are going to talk about today.
Sure. So the overview, we'll do a little bit of background in much as looking at the gut as the foundation of health. We'll go quickly through a few of the naturopathic philosophies and principles of I guess the way we look at medicine and the way we approach healing, and that is the therapeutic order and the determinants of health. And then we'll get into the good stuff, which is the inflammation, how we look at inflammation, where inflammation really comes from, and then compare and contrast some of the common testing that's out there right now, wherein people often get confused by the different verbiage that's used between food allergies, food sensitivity testing, food intolerance testing, and then about the Carroll method itself and how that compares, again, in contrast to popular dietary approaches. So that's kind of the overview for today.
Okay, let's start with the gut.
All right. So if you don't know who Hippocrates is, he's my favorite person because he is known as the father of medicine, or Western medicine, I guess. He was an ancient Greek physician, early BC, like 400 to 300, somewhere in there BC. But Hippocrates knew all the way back then that all disease begins in the gut. He's also quoted as saying, "Let food be thy medicine and medicine be thy food." And that is very much the foundation of what naturopathic medicine is at the heart. Another quote that I love to use, I've not been able to find who the author of this is all diseases are the same disease, a disturbance in the things that determine our health. So that sort of, I think, leads into the determinants of health, which is part of a naturopathic doctor's basic approach to care. Again, the foundation we look at is the gut. This is the way all energy, nutrients, hydration come into the body. Interestingly enough, a fun anatomy lesson for you, or maybe it's more embryology, is that when you form, you're a ball of cells, and then that ball basically becomes a tube. So you can think of like the tube of that your paper towel is wound around. And so all of the cells that were on the outside become the same cells that are on the inside. So anything that is going on with your gut can be directly reflected in your skin as well, which is why from a naturopathic standpoint, we never treat the skin first. Again, we always go back to the gut. 70 to 80% of your immune system is in your gut, various immune cells. This is why probiotics are really so important. We know they help a lot with digestive health, but more so it's to keep the integrity of the gut healthy so that those immune cells can be healthy. Going into the fall, cold and flu season, I tell people if you're going to do two things, one of them should at least be a probiotic. The other, my personal favorite, is cod liver oil because you get your vitamin D in there. Any kind of digestive upset, heartburn, acid reflux, any of these things, it all has to do with a balance in the digestive system. So some common things I hear people will say is, I have to have Tums every day. That usually means that your problem isn't too much acid, it's not enough at that point because you've been suppressing it for so long. If the food sits around in there long enough, it actually causes that gas and reflux that you feel. Even a true lactose intolerance is very rare from what I have seen. It ends up being either a dairy intolerance or a potato intolerance, which we'll get to. But really in a lactose intolerance situation, really the person is lacking lactase. The enzyme. So I've challenged people who thought they were lactose intolerant and then either found out later they were dairy intolerant or not, to go back and see if they really were lactase deficient. And no one's ever done that. And then other things, we try to rule out too, because obviously diet can't heal everything, can come close, but not everything, or structural anomalies. So for instance, I've had a handful of patients that no matter how much we change, the diet or work with anti-inflammatory approaches, maybe the sphincter in their esophagus, the connection between their throat, when they're swallowing food into their stomach, just anatomically, structurally is not, functional. And so maybe a surgery or something needs to be done. So those are just other very common things that come up when we start talking about the gut, because they'll say, well, what about this? And what about this? So kind of like to check those off the list right away to let people know that we are aware of those situations too. The final thing on the foundation is that gut feelings. People who have experiences with anxiety, depression, insomnia, anything behavioral, cranial nerve 10, your vagus nerve, actually is one of the nerves that comes off of the 12 that comes off of your brainstem, and it travels all the way down into your gut. So doctors like Dr. Perlmutter, who's a neurologist and who wrote Grain Brain, among other books, he is one of the many I guess, conventional Western medical doctors who is starting to understand how truly important the gut is. It's basically, like two ends of the same dumbbell. You have the brain and the gut. And for years and years and years, they threw drugs at the brain and none of those, clinical pictures got better. But when they started treating the gut and using probiotics, people with even schizophrenia showed improvements. That was a story in Dr. Perlmutter's book that I remember. So just a lot of foundational things about the gut. And then moving into the therapeutic order, this is, again, how naturopathic doctor, people will call me and say, well, do you have experience with this? Do you have experience with that? And the short and long of it is, I don't need to have experience with every single disease, because just like that first quote said, all diseases are the same disease. They're a disturbance in the things that determine our health. So we start with the very foundational things, the therapeutic order, and we start at the bottom and we remove the disturbing factors, the things that are determining or preventing your health from occurring. It looks similar to the food pyramid. That's the next diagram. And a fun way to kind of think about this is conventional medicine is almost exactly this, but upside down. So they always seem to start with the most high force interventions first. You cannot skip steps. And this is where I struggle with even some of my own colleagues, because it's become very popular to do a lot of functional medicine testing, which usually just amounts to recommending or prescribing a lot of supplement products. And the problem is if you can't skip steps in the therapeutic order, you'll notice that at the bottom of the pyramid, it's all about the determinants of health and establishing the foundation for health. That has to do with all your lifestyle factors. So diet is one of the big ones there. Then you have stimulate self-healing. Then you have support and restore weakened systems. And then you have physical alignment, which brings in like chiropractors and acupuncturists. And then you have natural symptom relief. So you can see supplements are 1, 2, 3, 4. They're the fifth step up from the bottom. And unfortunately, when some people think about natural medicine, that's all they think about is taking supplements and vitamins. And you've skipped a lot of steps, which means you're not addressing the true foundational, fundamental, piece of the puzzle. So we don't skip steps. True healing only occurs in this order. Like I said, you can't just take supplements. That's not a true fix, as it doesn't address the why or the fundamental cause. And essentially it is the least invasive to most invasive. And we start with the determinants of health, as I said on the bottom there. So after the diagram, we have the list of the determinants of health. We don't need to really spend a lot of time on this, but this just gives you an idea of all the different aspects of a person's health, medical history, personal history, lifestyle history, all these things that we're looking at to understand the full picture of health for someone. And as you can see under lifestyle, we have the essential determinants of health, first and foremost being nutrition and digestion, followed closely by water, sleep, breath, clean air, and vitamin R, which we say is rest and recreation. Not to say that any of the other components there are any less important, just that today the one we're going to focus on is nutrition and digestion. So moving on, how does food determine our health? Well, it sets the stage for healthness. It's really that simple. A few people to note if this interests you, a lot of where this foundational kind of information comes from and what determines our health in our diet. A really great book is Nutrition and Physical Degeneration by Dr. Weston Price. He really explored the introduction of modern foods into our diet and the degenerative changes in our health that showed up within one generation. He was a dentist, for those who don't know. So his primary focus was looking at the face and the jaw structure, the bones and the dentition. And he saw significant deterioration in that with the introduction of white flour, white sugar, all the modern white processed carbs and grains. Pottinger's Cats, a study in nutrition by Dr. Francis Pottinger, was another one that we learned a lot from in school. Notably, this was mainly about fertility within 2 generations, which we kind of look back now as the emerging field of epigenetics, understanding what's done to 1 generation, how within 2 generations it skips a generation, that effect can happen. And he did this by manipulating their diet. So through manipulating nutrition, or I should say, creating deficiencies in nutrition within a couple of generations, his cats, which he used this experiment on, showed effects of infertility. So it's understanding how our diet, our food, our lifestyle not only affects our health, but affects our genes and can affect subsequent generations as well. Back to the Basics of Human Health by Mary Frost. This is a really small little book. It's a really quick read for anybody who's interested in some of the concepts of organic food, non-GMO, whole food-based supplements, why organic is better and only whole food supplementation should be used. It's just a really great read. She was a nutritionist, I believe, maybe even a nurse, and she came across standard processed supplements. It was more so the work of the founder, and she was so stunned, I guess, by the results that she got when using this whole food organic based supplementation that it just spurred her to do this research and write this book for people. So I think it's a really helpful little book, again, to understand how food really has a detrimental effect on how food can have a detrimental effect on our health, or I guess determines your health, good or bad. And then chemicals and pesticides, obviously toxins that overload our body. We're clogging up our pipe, so to speak. The garbage man, also known as our liver, he can't keep up. There's overload that leads to other dysfunction that further leads to chronic illness, inflammation, and degeneration as well. So those are all ways that I've learned about health being determined basically from the foundation or the fundamental point of food. So inflammation and allergies. Now here's where the road splits, right? So I get a lot of patients that will call me, want a quick, the introductory free consult to say, hey, what is it you do? How can you help me? And when I start talking about the food testing, they'll say, oh, no, I've already done that. I have food sensitivity testing. I know what my food allergies are. And this is the little spiel that I give them. So you have acute inflammation, right? When you have, say, an injury, you have all the cardinal things, redness, swelling, pain. Those are things that are there essentially, and it doesn't feel good, but to protect the body and in a process of healing. And you have chronic inflammation, which could be due to any kind of ongoing stressor, including food, namely food, right? As of today, that ultimately damages the body and can be the underlying cause for things like leaky gut. Allergies, on the other hand, boil down to basically our immune system overreacting to a normal stimulus. So that's why when you have allergies, spring allergies, let's say, someone who, the hay fever, outdoor stuff kicks in and your nose is running clear. The reason it's running clear is because there's no infection, right? So if it's green or yellow or any other nasty color and chunky, that's your body getting the infectious, the byproduct stuff out after the infection. If it's clear, it's just there's nothing there. So it's an overreaction. And there's several types of allergies, and they're all rated as levels of hypersensitivity. So you can have food allergies, environmental allergies, chemical allergies, drug allergies, and so on. So when we get into allergic reactions, then we're still within the immune system, talking about how the body is responding to things that are triggering it. And basically there's two types. And this is a really oversimplified way to explain this. But I just want to touch on it because these are some, I don't want to say like hot words. These are things people hear like, oh, I got the IgA, food sensitivity testing. So within allergic reactions, you have IgE, which are type 1 hypersensitivity. These are the ones where people usually need to carry an EpiPen. They can be life-threatening. Then you have IgG and or IgA. So these are different, we'll say, little receptors, for just keeping this simple, in your immune system. And when it comes to IgG or IgA, you're talking about a type 2, 3, or 4 hypersensitivity reaction. And what that means is it's a delayed reaction. So the reaction you might have may occur anywhere from 24 to 72 hours later. There's usually no need to be carrying an EpiPen for these types of things. And a lot of times this is what the food sensitivity testing is looking at, either IgG and or IgA reactions. So they're taking your live blood and then they are exposing it or triggering it by exposure to some kind of food and seeing if those cells react. So most that I've come across are still IgG, but some IgA are popping up. Like I said, it's a provoked immune response, so you must have had a recent exposure. Some of the most popular tests out there right now are ALCAT and ELISA testing. You can use, usually they use about 4 to 6 vials of blood. So it can be a lot of blood. Sometimes the IgA can be done with saliva. But the whole point here is that it doesn't actually fix anything. It basically identifies an end result, which is that you've been eating your food intolerances. You've been creating toxic metabolites, creating toxemia, creating chronic inflammation that's damaged the gut. And basically food is getting outside of the gut. And so when your immune system sees that and says, hey, that stuff's not supposed to be here, it creates this response. So really all you have with allergy and food sensitivity testing, if you get any kind of results back, is a positive for a leaky gut or a damaged gut or a gut that's not at its optimal integrity. So there are a few other methods I've seen out there. There's the traditional skin prick test, Vega testing. There's these biofeedback types of tests. I think it's a method of trying to use muscle testing or applied kinesiology through like a machine. But again, I haven't seen the clinical significance of any of these tests. They all have shortcomings, again, because it's just your immune system. It's not addressing the root cause. And for instance, with the applied kinesiology or these biofeedback type testings, I have a really good example of a patient who came to me and she said she'd been told she had several different food sensitivities, and one in particular was yeast. And this practitioner had told her, pretty much every other visit, I'm having a response to yeast. I'm not having a response to yeast. But what we know from the Carroll method is that yeast often contains potato. as an anti-caking agent in it. So what happens is his result was dependent on the type of yeast he was using to test her. If he was using a brand of yeast that didn't have potato in it, she wasn't having a response. If he used a brand of yeast that did have potato in it, she was having a response. And potato just happened to be her primary food intolerance. So you can see how, you can always dig a little deeper into some of this. There is one comparative published study that compares a lot of those different approaches to the Carroll method. It's not good or bad necessarily, but again, you have to understand the type of testing and what they're looking at. And so when they compare these tests in the table, the first thing they'll say is, oh, the ALCAT tests 800 foods and spices. And then they'll say the Carroll method only tests 8 food groups. And that makes it sound like it's not doing a lot. But in the end, it's actually exponentially more, right? Because if you test one food group, that could be in any number of things, right? So you don't have to test every single sample of food that this person would ever come into contact with. So you get a lot more for your money, basically. Now, coming to the Carroll method then, this was created by Dr. O.G. Carroll. He was a very notable naturopathic doctor, very well known, practiced in Spokane, Washington from 1908 to 1963. He had a chronically ill son, and through all of his naturopathic training, he could not get this kid of his better. And in his search for other answers, he discovered Dr. Abrams' work. Dr. Abrams was a professor of physiology at Stanford. And what he understood is that all living things carry frequency. And so he had been working on a method of diagnosis that revolved around using frequency. And what Dr. Carroll did was he modified this, or basically incorporated food into the assessment. So what this allowed him to do then was identify food groups and combinations of food groups. And ultimately, we say they're being maldigested. It's an easy way to say that they're being improperly digested, or essentially that toxic metabolites are being created. It's creating the foundation for toxemia and subsequently chronic inflammation. So using this method, he discovered his son was fruit intolerant. He removed all fruit from his son's diet, and his son's full health returned. So people traveled far and wide for this, which, as you can imagine, in the early 1900s was really something. When I went to the Carroll Institute, I learned a lot more history about Dr. Carroll that's not really out there for public consumption yet, because one of the doctors is still working on a textbook to have all this information in. But there's a story of someone coming from, 2 states away on the far side of Idaho, whose car broke down, and he stumbled into a mechanic's office. And in the meantime, he hadn't felt well, found his way into Dr. Carroll's office. And that turned out to be Dr. Tom Dick. And so he then trained Dr. Jared and his daughter, Dr. Letitia, and they are the 2 doctors that founded the Carroll Institute now. So this is, I'm the 3rd generation now from Dr. Carroll. But the point is, even with Dr. Dick, he was 2 states away, and he believed in it so much, it changed everything so much for people in his life, that he moved there and took this up, and he didn't do anything special before that. And again, this was one of Dr. Carroll's quotes: health must at all times come from and be maintained by digested foods. And we should probably say properly digested foods, right? So the Carroll method methodology. So this dives a little deeper into what we're actually looking at, right, with the Carroll method, because that's what everybody wants to know. Well, what are you testing? So you have to remember that this was a time before the American Medical Association and the Flexner Report, which, if you haven't heard of it, look it up. This is what basically set the foundation for Western medicine as we know it today. So it unified medical doctors in their training, in their practice. It told them what they could or could not use as a method of diagnosis. And unfortunately, the AMA did not think that Dr. Abrams' technology was valid. It was basically, what do I want to say? What's the word I'm looking for? It was not vindicated here. They didn't believe that it was a proper method of diagnosis, and they basically outlawed it, I guess is the word I'm looking for. But his methodology was vindicated and is still widely used in Europe today. If you wanted a more modern term for it, you would call what he did radionics or radiodiagnostics, discredited in the US. See, the word is on the slide. So basically, again, he was using different frequencies for different organs to check on the state of health and functionality of that organ or system. So in this case, Dr. Carroll just focused on the digestive organs. And it's kind of similar to biofeedback, but it uses a unique microcurrent frequency. And the results are simply a positive or negative to the food. So I know, again, patients that have come into my office with their pretty colorful 15-page reports from their LCAT tests, and then I simply give them a piece of paper that says, you're positive for potato. Here's some examples of potato. And they'll say, well, where's my results? These are the results. It's nothing fancy. Either the frequency is interrupted or it's not. So again, a more technical name would be bioenergetic electrodermal method. And over time, I know it's sometimes hard for people to wrap their head around alternative, methods of diagnosis, but you have to remember there were a lot of different methods of diagnosis back then before the AMA outlawed, other questionable ones, and people still got better. So, I've had people come in and swear up and down, it's not the food, it's not the food. And then we do this, and I only ask them to make this one change, no supplements, no other products for a month. And time again, when people come back, they'll tell me, I'm about halfway better. I'm definitely, 40, 60% better. And then we'll, use some of the products to kind of go the rest of the way. So again, an intolerance is different than your standard IgE allergy, than a sensitivity, which is the IgG or IgA. Those both have to do with the immune system, right? So something totally different. We're talking about the digestive system and inflammation. Allergies and sensitivities are talking about the immune system. And then you have the blood type diet, which looks at lectins in the blood. So again, I think Dr. Diadamo, who created that approach, he's understanding that it has something to do with the blood, but it's not the full picture like what the Carroll method is. So overall, when you get the Carroll method evaluation done, there's typically one primary intolerance. Most common are dairy, egg, potato, fruit, or sugar. There are some less common ones like meat and mined salt, honey, soy, or fish. You can have more than one primary intolerance. It's not super common, but I do have it pop up now and then. And then there's the combination and separation. So even if someone has managed in some way to stumble on their primary intolerance, which is not uncommon, right? If you know that food's been part of the problem, they've been experimenting with different kinds of elimination diets, or just saying, all right, I'm going to cut out all refined foods, carbs, sugars, whatever. It's not uncommon to stumble on your primary intolerance group. You'll know because you'll feel so much better, right? You cut it out for a while, and then when you add it back, you don't feel so great again. But the combination, I think, is what really makes the Carroll method stand out. And that is because it's often not that one group of food is bad for you. It's that having it in combination with another one is. So, for example, the two most common combinations that I see are fruit and sugar, or potato and grain. So again, you've got really popular diets out there removing grains, removing carbs, removing sugar. Well, what if you could still have potato and you could still have properly prepared grains? You just had to have them separate. Maybe it was separate by 4 hours or 6 hours or 8 hours. So I look at that as a good thing, because maybe this isn't a more restrictive diet for you. Maybe this is giving you information to bring food back into your diet that you've been missing because you didn't know it was the combination of things that you couldn't have. And as your function improves, usually that separation lessens over time as well. And what I mean by that is the more you remove it, the more you heal, the more you get back to, a healthy baseline, the less of a separation you'd probably have to maintain. So how is it done? It's very simple. So it's just a dry blood sample, and we just do a finger stick similar to like what a diabetic does with the little, cartridge finger stick. You can do a finger, you can do an earlobe, you can do a heel or a toe. It doesn't really matter. All you need is about the size of a dime on a sample piece of paper. So I run the preliminary panel for patients. I get them results usually within 24 hours. And then I send that preliminary panel off to the Carroll Institute for confirmation. They get back to me usually within 1 to 3 weeks. I can do this all by mail order because it's a very simple thing to do. I send the kit to you, you get the blood sample, send it back to me, and then I do the panel and send it off to the Carroll Institute. Another question that I get about this is, will I have to have it redone? No, you were born this way. It will never change. And you'll never have to, get updates or develop new ones. It's a very, very simple, straightforward approach. And I know that usually makes people happy because, again, I've had patients who've been spending hundreds, if not thousands of dollars a year, maybe once or twice a year, redoing their ALCAP panels. So in fact, one of the older NDs that I've learned from used to even do this method on newborns, because there was a time when naturopathic doctors, just by default of their practitioner or their practice, their learning, were required to do midwifery, and they were required to deliver a certain amount of babies as part of graduating from naturopathic medical school. And so when certain people saw how effective this, dietary evaluation was, they did it on newborn babies right away so that the mother had that information to start the baby off on the right foot. And I have actually even had patients whose mothers were still breastfeeding them, and the mothers found that if they even avoided the baby's food intolerance, that the baby would improve as well. So the baby may have his or her own intolerance, and the mother may have an intolerance as well. But I have seen moms who swear that avoiding their baby's intolerance helps as well. So any way you cut it, if the baby is still being breastfed or if you are introducing solid food, this helps you get off on the right foot with your child. And me personally, I was following the Sally Fallon, who founded the Weston Price Foundation. One of her books, it's the Nourishing Traditions for Baby and Childcare. And I was following that for food introduction, and they wanted to do eggs and grass-fed liver. And I happened to do my son's food intolerance a few weeks before I was going to start this. And I'm glad I did, because his primary intolerance was eggs. So I was about to start him on 2 foods, one of which was the one thing he shouldn't have. So thankfully I had that information, and he's been a really healthy kid. My theory, when people ask me about, why is it this way? I've been eating dairy my whole life. Why is it just bothering me now? Well, but it's not just bothering you now, right? It's been a cumulative thing over time, and everybody's body can handle a different load, if you will. So it can depend in part on your genetics, right? The hand you were dealt. It can depend on your lifestyle, your other exposures, all those things that we talk about in the determinants of health, all those things that are determining your health. And you can think about it like an iceberg, right? So just the tip of the iceberg is above the water. That's the symptoms. So your symptoms aren't the first sign that something is wrong, but rather the last sign, because your body can't keep up anymore. It can't compensate anymore. And there's a lot going on under the surface with icebergs, the little part that sticks out over the water. So that's us addressing everything below the water with a food intolerance and with the UNDA numbers, kind of hitting the reset button for people. Trying to think of what else. Yeah. And I can have someone who's 75 with arthritis. They all still see positive effects from making these changes based on the Carroll Method in their diet. It's never too late. Reducing inflammation is ultimately what it boils down to. So I have a few slides about other popular dietary approaches. And I guess I don't need to go over all of them, but the information is there just to highlight again how I said sometimes people will stumble on their food intolerances. I know a lot of dietary approaches, really, they're more revolved around weight loss than health. But ultimately, it is health, right? However, we need to always address your internal toxic load because ultimately that is what's stored in fat. So if this is a weight loss thing for you, you still have to address it. You need good fat for some of your most important organs, your brain and heart, and you can actually drive your cholesterol too low. I mean, that's one of the dangerous side effects of statin drugs. So I will have people come in with health concerns, but also they'll say, I know you're not a weight loss doctor, but if I lost some weight, I wouldn't be upset. And what I tell them is this is still going to help because when your body becomes overloaded with chronic inflammation, with these toxic metabolites, one of the safest places to store them becomes your fat. And so people who have really stalled out in their weight loss efforts or trying all these popular dietary approaches and getting really frustrated, it's because they're not addressing the toxic load. So they're trying to burn the fat, they're doing these things, and then the body says, oh, no, you don't get to burn that fat. That's my safe storage for all the junk that your body's making that I can't deal with. And so once you address that through making the dietary changes based on your Carroll Method results, you quit adding to that burden, and then you use the UNDA numbers to address that toxic load, and then that frees up that fat for weight loss. So it's kind of a long approach. Now, again, with the dietary approaches, things like paleo, keto, intermittent fasting, Whole30, sugar detoxes, all these things, really what they're doing is they're finding all of the scapegoats, if you will. Not all, some of them are bad, right? Like we know refined sugar is bad, but none of those things are customized to the individual. They're very general. They're removing the most common known inflammatory or offensive foods. And it's really not rocket science, right? It's just the most highly processed foods, the foods that are most full of chemicals and additives. And some of them you may still want to avoid regardless of your food intolerance, right? Like gluten or refined sugar. So two examples that I have here that I'd like to share in regards to how a Carroll method can still be much more effective, save you time and money than trying a dietary approach. The first one is a gal who she and her sister were both diagnosed with the same hypothyroid condition. Her sister went paleo, everything got better. She went paleo, everything got worse. And she came into my office and she said, I don't understand. I went paleo, I did strict paleo, I even cut out the dairy. I don't know why I got worse. And when I did her Carroll method of, food intolerance evaluation, she came back as egg intolerant. So on the paleo approach, she had gone from eating 1 or 2 eggs a week to eating 3 or 4 eggs a day. So she was primarily fueling herself with the one thing that was not compatible with her body. So as soon as she pulled that out, we started making progress again. Another gal, like I said, in the beginning, for people who've been told they're lactose intolerant or have a dairy issue, and they will go paleo or strict paleo and cut out the dairy, they'll still find that they're having issues. And the reason is because a lot of areas potato sneaks into. And what I mean by that is people say, oh, potato, I don't eat a lot of sweet potatoes. I don't eat French fries. I don't eat potato chips. The problem with the potato intolerance is actually complex. And my younger son has a potato intolerance. So I'm getting a lot of experience with this personally now. Potato is often used as an anti-caking agent or a thickener. So it sneaks in a lot of places. So somebody who goes strict paleo because they want to cut out the dairy because they think dairy is the problem will come to find out that really it was the low fat skim milk that was the problem. So any dairy that they pull the fat out of, they put potato back in it to thicken it back up, to give it the consistency that we're used to. And that's true for the sour cream, the cottage cheese, the milk, any of it. It's usually there in the form of ascorbyl or ascorbyl palmitate A. So, I mean, just read your ingredient label. It's right there. And then you have things like the yeast we talked about, baking powder, even iodized salt has potato in it because it's there as an anti-caking agent. So a lot of times it's just unraveling the mystery for people. My old recommendations, followed a lot of these, dietary approaches today too, no refined sugars, avoid gluten, avoid poor quality dairy. It was never so much I guess I never recommended any specific dietary type for people. I wanted them or approach, I wanted them to have the freedom to choose that for themselves, but just understanding that it's more about choosing the quality of the food. So I know, sometimes I'll get people that will come in and, they'll say, oh, I don't eat any meat, or I don't eat that dairy. Meat and dairy can be very good for you in very good high quality forms, right? I mean, organic, grass fed, pasture raised, there are better forms of food. There's also good sweeteners and bad sweeteners. So that's all stuff that I usually go into a lot more detail with people once we've gotten their results back. Like I said, the next few slides are, again, just, touching on, what is a ketogenic diet? Why is it working for people? How does it work? Paleo diet, intermittent fasting, is more about when you eat so much than what you eat. So a lot of times people are pairing intermittent fasting with something like paleo or keto. Again, it's usually to ramp up the metabolism. You've got Whole30, which is not, personally, I don't feel like is a good way to eat regularly. I think it gets really strict for people. But it is a good, a lot of people like to do that seasonally as like a detox type thing or a jump start to weight loss. But again, it literally cuts out everything that could possibly contribute in any way. Another popular one was the 21-day sugar detox. We touched on the blood type diet. Michael Pollan's books all talk about similar things. It's about the quality of food. You've got the Nourishing Traditions series from Sally Fallon. There's some really great ones there. A lot of them are centered on bone broth and eating more traditional diets. Like I said, that kids book is really great from her. And then a newer one that I've been using myself personally was Super Nutrition for Babies. And it basically is a more modern and updated version of Nourishing Traditions by Sally Fallon, and a lot of it's based on Dr. Price's work too. There's still a lot of sources out there if you're interested in going gluten-free or grain-free. There's a really great cookbook that I like to share. Usually it ends up being with a lot of parents, Delightfully Free, that's dairy, sugar, and gluten-free. There's a lot of Allergy, again, cookbooks out there, but still those end up being good for some of my patients because if they come back with an egg intolerance, it's one of the top 10 allergens. So any recipes that fall into allergy cookbooks, for them make great resources as well. There's a lot of paleo keto cookbooks out there. Any way you want to do it, basically. So what I recommend to people is I say, let's get your Carroll Method results, and then you can tweak any of the above, so if you like keto, you like paleo, here's some resources for you. It's a really great way to start, one step at a time. But ultimately, it is one of the most foundational ways that I start working with people. And like I said, it boils down to addressing the determinants of health, the lifestyle, food, by the Carroll Method, removing one of the biggest causes of inflammation. We obviously address everything else. Sleep, hydration, stress is a big one. All of these things so that we can set the stage for healing. We clean up other common causes of inflammation, which can be chemicals and personal care and home cleaning. And then we use those UNDA numbers. So the customized homeopathic drainage protocols. We can target specific glands, organs, or organ systems and work on cleaning out that built up stuff. So with the Carroll Method, you're, helping to not put any more junk in, stop creating the inflammation. And then on the other end, we use those homeopathic products to help clean out the old stuff that's built up so that your body can start functioning the way it would like to again. So that's everything in a nutshell. Did you have
That's a lot of,
Want to make
that's a lot of information to digest. So yeah, we do have questions. So
perfect.
okay, so yeah, something. Okay, so do you want to say something? I'm sorry, I'm talking to the attendees. There was some question. You want to type it up? I didn't understand the entire question. You were typing it. So can you, I'm talking to the attendee, can you please type up the question? I think someone was trying to type up something. I'm going to stop the share and see what they were trying to say.
Sure.
Okay, it's in the chat window. Regarding the diet, okay. All right, so there you go. So someone is asking regarding the diet changes in effort to detox or lose weight. My understanding is that especially when one's liver is not working so well, a lot of heavy metals, chemicals, and other may go in the blood and not be excreted out. How many days, weeks, or months might such person want to support the liver for before altering the diet? That's the question.
Well, the liver is helping the gut ultimately. So I think my answer there would be to flip that, really. I think you want to address the gut first to stop putting additional burden on the liver, because any products, whether it's the homeopathic detox stuff that I've talked about or other things that you're doing for liver support or detox, to make the most significant effect, you'd want to alleviate any other burden on the liver that could be there from food to begin with. So the gut, liver, kidneys are generally what we refer to as the main organs of elimination. And so again, everything coming in digestion wise, at some point, if the digestive system can't keep up, it's going to back up and ask the liver, kidneys, and other organs of elimination to help out. So I would still make dietary changes for a month, see what's changed, and then that may dictate how much more or how little you are able to achieve with that.
Okay, so someone continuation of that, they're saying but if you clean out the burden on the gut, the liver and kidneys, if weak, may not be able to handle the toxic load being cleaned out.
Okay, so we're not doing any kind of detox on the gut by changing the diet. We're not adding any more inflammation in. So if the liver and kidneys are weak, it's going to help the liver and kidneys if you stop eating food that's causing inflammation in the digestive system that might be backing up to the liver. So the dietary changes aren't adding a burden to the liver, they're alleviating it.
Well, if you have more questions, I've written our email as well, care@nourishtalk.com, and you're welcome to write down the question. And if you want consultation, we'll direct you to Dr. Whitney. So any other questions? There's a lot of information that you put, which is, oh, sorry. I made a mistake. You're right. Typing sometimes does that to everyone. It's care, yes, I got it right now. care@nourishtalk.com is the email. And you know my name, Amita. So, you're welcome to say you attended the webinar and give that as a reference. Okay, I think I did it right. Any other questions from any of the attendees? Okay. All right. So she's asked, she or he, whoever it is, I don't know, can inflammatory foods affect the brain? Well, you talked about the gut.
Oh, absolutely. Yeah, absolutely. Yeah, the inflammatory foods can affect any system, any organ, any gland. In fact, I will give you a little sneak of information, and that is that primarily I have seen, and what's been historically true with the Carroll Method, is that almost anyone with any kind of nervous system related, brain related, it can be behavioral health, depression, anxiety, anything like that. Children, even with ADHD, autism spectrum disorder, a lot of times they're fruit intolerant, which is very often hard for people to accept because they want to believe that fruit is a healthy thing for them. But ultimately, you have to remember that fruit is about 80% sugar. It may be a healthy sugar, it's fructose, but it is sugar at the end of the day. And so I think you can kind of look at this as there's sort of 5, main groups. Your body can manage 4 of them probably really well. And then it's that 5th one is just too big of an ask. And sometimes it ends up being something that we do think of as healthy, right? Fruit is often thought of as healthy. So are eggs. Eggs are thought of to be very, very healthy. But even before I did the Carroll Method, I often would tell people you need to think of fruit as a treat, as a dessert, because it ultimately is sugar. And if you don't use it, it stores up, you build it up. So, eat mostly protein and veggies, and treat fruit as a treat, just like that. So,
Okay. Following up on that, after how many months or years could someone eat the allergic food without an allergic reaction after repairing the gut and not exposing oneself to these triggers?
Okay, so if they're actually talking about foods that they've tested as
Yeah,
allergies, food
that's right.
allergy,
That's what I understand. Yeah.
I would say, yeah, I would say that you need to remove your food intolerance, and probably do a little bit of gut healing, which there's some really great products out there, like anything that contains glutamine. There's lots of good healing botanicals for your gut. Usually some combination of those with some probiotics and that reduced inflammation diet for several months. And then I would say you could probably experiment with like one thing at a time, maybe every 3 days or so, usually is what we say. Don't introduce anything new more than every 3 days. So if you maybe did an experiment with one thing for a week and then tried something else the next week, you certainly don't have to wait years, but I would definitely give it at least 1 month, if not 2, and 3 would be, more ideal. But if you're just talking about food intolerances, those never go away. Your more immediate reactions may lessen. So if you're someone who's, like I said, to the point of, the straw that broke the camel's back or the tipping point, and it's now every time you eat migraine, removing that from your diet for a period of time, at least a month, you will usually see significant reduction in those more immediate symptoms. And you can sort of build up again, like I said, over time. The more you avoid that, the more area your body sort of has to work in to compensate. So you might be able to sneak something like that back in here and there without having the migraine again. But you have to remember it's always cumulative. So if you start cheating and you keep cheating and it builds back up again, you might get to a point where you start having the migraines or the digestive disturbances again. For some people, they're just, again, it's your constitution. They're just more sensitive people and there's no cheating for them. For other people, they clean it up really good for a few months. We do some of the detoxification protocols, everything gets better, and they find out that, yeah, I'm dairy intolerant, but I can have yogurt once a week and I'm fine, and that's just, it's the information. You have the information, what's going to fuel health or illness. So it's really up to the individual as to how much they want to remove or incorporate that in their diet.
Okay. So hope we answered this question. They're saying thank you to the host and Dr. Cronin. So that's good.
Thank you.
Anything else? We have time for one last question. We are almost at the hour. So if we have time for one last question before I wrap up. Okay. All right. There's a lot of information, a lot of good information that Dr. Whitney shared with all of us. If you're welcome to replay this entire session again and tell, reach out to us if you have more questions, if you can't think of the questions right now. With that, I'd like to wrap up this session and thank you so much for being with us. Any last comment from you before I wrap up, Dr. Whitney?
No, I'm very thankful to be here today, and thank you everyone for joining.
Thank you so much and have a great Sunday afternoon. With that.
Great, thank you, you too.
Bye-bye.